First and foremost, I just want to say a very big thank you to all of you listeners who have decided to listen to my website. Secondly, to save on time, I would like to draw you to a sample of telephone conversations with the various nurses, doctors and secretaries of the National Health Service Mental Health Division. Let's start with my December 2014 telephone conversation with Miss Llewellyn Jones, who was insistent that my son could only spend 7 hours and not 10 hours with me during the Christmas period.
Good morning to you. Afternoon to you. Can I go with Mr. Llewellyn Jones, please?
Yeah, sure. Hold on. Hello?
Hello there, Mr. Llewellyn Jones?
Yes.
Yeah, hello there. It's me, Ollie Yemi's father.
Oh, hi. How are you?
Very well, thank you very much. I'm
Good.
just inquiring about the 10 hours for tomorrow because...
Yeah, I think that won't be possible. I mean, we agreed 7 hours the other day, and so that's what that was the agreement with everyone there. So
the thing is, I mean, it gives them no chance to enjoy the church service for any family member.
yeah, I think 7 hours is quite long enough. I'm sorry.
No, I beg your pardon. You're saying 7 hours is long enough. I mean, during the festive season, are you going to be with your family?
I can't discuss this anymore. I'm sorry. We agreed 7 hours. We agreed 7 hours.
I don't expect that because my son's got, we've got family and we have to make the whole family within 7 hours.
Well, 7 hours is what we agreed at the meeting, and that's what we're sticking to. All right? I can't really go any further than that. Okay, so happy Christmas.
Don't give me your happy Christmas. Thank you very much. Don't give me your insults.
Happy Christmas. Happy Christmas. All right? Bye-bye. Bye-bye.
Now let's listen to the comments of Miss Catherine Murchie, who is one of the secretaries for Dr. Alia Jazz, whereby she is stating they do not keep copies of the minutes for any of the meetings.
Hello?
Hello, is that Catherine?
Yes, speaking.
Hello, Catherine. It's Samuel, Oluyemi's father.
Sorry, who?
Samuel, Oluyemi's father.
Oh, right, yes.
Yes. Just to let you know, I still have a copy of the CPA minutes.
Right. I don't think there were any CPA minutes.
No, that's ridiculous. Can I stop again? You're dealing with my son's life. You're dealing with my son's life. And you're dealing with patients' lives. Are you telling me in the last, however long that your bill has been going, you don't keep minutes of CPA meetings or family meetings? Is that what you're telling me?
Well, I'll find out. The trouble is, Dr. Sullivan's on holiday.
No.
I'm sorry, Dr. Ajaz it is now.
Right. Now, I'm going to tell you again. Are you telling me you do not keep minutes for any CPA meetings?
No, we do keep minutes.
Then why haven't I received a copy?
Dr. Ajaz is the new doctor, and I'm not quite sure.
No. This was done on number one, Mrs. Llewellyn Jones' watch, and she promised me a copy of the minutes. I've also sent you emails to tell you that I need a copy of the minutes, the family meeting and the CPA minutes, and you've repeatedly failed to give me copies. Why?
Oh, well, I'll look into it. I'll ring up the walls and find out.
But it's your responsibility.
I'll ring up the walls and find out.
It's your responsibility.
Sorry?
It's your responsibility to make sure...
I'm a medical secretary. I can't dictate what they write up as reports and that.
Okay, then why haven't you responded to my emails? Where I've asked if I reminded you that I need copies.
I don't reply to your emails. That's Dr. Ajaz.
No, I wrote to you directly. It's your email address. Catherine.Murphy. That's your email address, correct?
Yes, yeah.
Right.
What's that?
So why, you've responded to my other emails, but why have you refused to respond to every time I've requested a CPA minutes and the family meeting minutes? And why haven't you changed it up?
Right, I'll put you through to my supervisor.
Who is your supervisor? What's the name of your supervisor?
I'm going to put this call through to you.
What's the name of your
supervisor? With me.
What's the name of your supervisor?
It's Lorraine Collins.
Thank you.
Now let's listen to the comments of her Mrs. Lorraine Collins, the supervisor who I made very well aware of the fact that I am actually Oluyemi's power of attorney, whilst at the same time she was also making a claim that their social worker can actually stop me from having any of the meetings.
Hello there. My name is Samuel. I'm Oluyemi Kahindi's father. I've requested. I'm Oluyemi Kahindi's father.
Okay, which ward is he on?
Woodbury Ward.
Okay.
Right. I've written to your Miss Murchie via email on many occasions and requested verbally on many occasions a copy of my son's minutes for the family meetings that was held in December 2014 and the CPA meeting that was held in January 2015. Now, I have not received a copy of any of the minutes, which is unacceptable. And as I've said to your colleague, I mean, are you actually saying, since the time your building has been erected, that you do not keep copies of any minutes for any CPA or any family meetings?
No, we do keep copies of minutes.
Right. Then why am I not entitled to those minutes? Bearing in mind, I'm also, just to remind you, I'm Oluyemi's power of attorney, just to remind you, which I stated at both meetings.
Alright, can I take your phone number? Because what we need to do is speak to the social worker. Because the social worker decides who gets copies of the minutes. It's not really up to us, the secretaries. We can't decide.
So are you also saying that social workers can actually decline me CPA meetings, minutes of CPA meetings and family meetings? Is that what you're saying? They can actually.
Sorry? They what? Sorry?
Are you saying that social workers can actually decline giving me those minutes?
I don't know. I say it's not one of my patients, it's not my ward, but we need to speak to the social worker for Woodbury.
Right.
And then they can say yes, because I don't know, I can't say to the secretary, yes, give you a copy of the minutes. It's not up to me, I've got that.
I've made this request since December last year.
Okay, what's your phone number?
Before I go further, before I give you the phone number, I'm reminding you, I've been making these requests, which you'll see on our email, since December last year, repeatedly.
Right.
Now we're now in February, so it's December and January.
You haven't had a copy?
I haven't had a copy, and I haven't had a response from your Miss Catherine Murchie. If this is what you're saying now, why has she not responded to my emails to give me?
I don't know.
I believe you're her supervisor?
Yeah.
As I've just been told, and you don't know?
Okay. No, I don't know. I wasn't aware.
Since December, January, you ask her to check her emails, and you'll see since December, January, and February, I've been making requests for these and phone calls since January. So, beg your pardon, December 2014, January 2015, and February. I repeatedly requested to have copies of these minutes. Now, it was her duty to challenge the people in advance of my phone call today to get me copies of those minutes.
Okay, well, sorry about that.
Now let's listen to the reaction of the Good Mace hospital consultant when she decided that I am not allowed to associate myself with any of the patients or their families or any of the other carers.
Number one, I've asked the staff to put your statement in writing, which you refuse to do. And if you're going to make that statement, you should put it in writing to me, number one. So can you put it in writing?
Well, if it's a clear policy that the relatives or patients should not talk to other patients, yeah, we do that. Like what I'm saying.
No, I want it in writing. No, what are you doing in writing?
There's no need in doing that.
There's no need in doing what?
Talking to other patients.
No, I want it in writing. This is an example of what I said to you about talking sensibly to the patients. It's a simple.
It's sensible for them. It might.
No, I'm not worried about it. Forget the patients now.
Yeah.
It's strictly between me and you and the hospital. You need to put your statement in writing to me. Can you put in writing that it's not advisable for?
I will talk to our manager. Yes.
No, can you put it in writing?
For myself, because it's a managerial.
No. There's
it's not a clinical issue as such.
You said it's a policy.
After 5 years of trying to obtain my son's medical and financial reports without success, on Monday, 23rd February 2015 of this year, I decided to inform the NHS that I had been secretly recording all of our meetings. Within minutes, there Dr. Ali Ajaz rang me with great haste to invite me to come to a meeting on Thursday, 26th February 2015, of this same year so that he could give me a copy of my son's care plan. However, I received a phone call from a whistleblower warning me not to come as their Dr. Ali Ajaz was planning to kidnap, detain and section me. With this in mind, at 10 o'clock on the morning of our scheduled Thursday 26 February 2015 meeting, I rang their secretary to tell her that I will be collecting the care plan from the reception at 12 o'clock so as to give me a chance to read through the documentation before our scheduled 2 o'clock meeting. Now let us just start with that 10 o'clock conversation that I had with one of Dr. Ali Ajaz's secretary.
Hello, Angela speaking.
Oh, good afternoon, Angela. My name is Samuel. Can I speak to Catherine, please?
She's on leave today.
Okay, that's fine. It's just Samuel. I sent an email to Dr. Ali Ajaz asking if you could send me a copy of the care plan by 12 today, because I'm actually busy at this moment in time, but give me a chance to at least read a care plan before I get to see him.
Okay.
Do you see him at 2 o'clock?
Which patient is this for?
Oh, Oluyemi Kahindi. I'll spell that for you.
Yep.
O-L-A
Yep.
Y-E-M-I.
Y-E-M-I.
Yeah, and it's
Oluyemi.
Yeah, Kahindi. K-E.
Yep.
H-I.
Yep.
N-D-E.
Okay.
Yeah.
And who are you? Sorry, Samuel?
I'm Samuel, his father.
Oh, okay.
Lovely. And I'll give you my email address.
Did you want it to email? Yeah, that's
Yes.
Now let's listen to the return phone call of the secretary, which came at 11 o'clock. So some 1 hour later, the secretary rang me back. So let's hear what the secretary now has to say.
Good afternoon, can I help you?
Hi, is that Samuel?
Yes, it is. Hello there.
Hi, Samuel. It's Angela. I managed to catch Dr. Ajaz as he was coming out of a meeting.
Okay.
And he said that the care plan will be available at the meeting, as discussed.
Then in that case, tell him that there's no point in continuing the meeting. If you can't give me the care plan beforehand for me to read it, because the last time I got the care plan, it was 31 pages of absolute nonsense, and it gave me no chance to read it. And just to tell me to come to a meeting to take a look at a care plan without having advanced reading of it, yet he's had more than 24 hours to read it himself. You know, obviously more than 24 hours to prepare it is totally unacceptable. So for now, the committee is going to be cancelled. All he has to do is book another appointment after he sent me a copy. So I want him to send me a copy in the post, and then we can take it from there.
Okay.
Thank you.
All right, then.
Thank you. Bye.
Now let's listen to Dr. Ali's return phone call, which arrived at 11:09, some 9 minutes after my conversation with one of his secretaries. Now notice how he states that he does not feel that it's safe to send the information by email, and furthermore, how he also states that he doesn't feel it's safe enough to leave at their reception desk, so to speak. I also want you to pay attention to two significant words: the words I and we. I, as we all know, is singular. We, therefore, means that I would have had to face more than one person. But nonetheless, let's hear what Dr. Ali Ajaz has to say.
Good morning, can I help you?
Hi there, what are you doing? Dr. Ajaz here.
Hello, Dr. Ajaz.
Hi there, hi. I'm just speaking to one of the secretaries said that she's been in contact with you this morning.
Yes, indeed.
About the meeting. It's about the care plan that you wanted sent over.
Yes, indeed.
Yeah, well, I mean, there's a number of difficulties with that. I guess the first one is that having secure emails of kind of how we send things across.
Right.
So I think that's probably kind of the main with kind of going into their own kind of information governance kind of to send non-secure emails. But we're more than happy to go through it with you when you come here, and you can take it away with you. No problems in doing that.
Okay, in that case, what I would suggest we do, in that case, because you say you have a copy, is that right?
Well, yeah, we have it saved, so I can print it out.
and I'll come along around about the 12 o'clock mark to pick it up from reception. So at least it gives me at least a couple of hours to read through it, and then I can get back to you.
Well, if you want to do that, then we can. And then we can still meet at 2 o'clock.
Yeah, then the meeting will still be at 2 o'clock. So if you can leave me a copy at reception, I will pick it up at around about the 12 o'clockish mark, and then we'll take it from there.
Well, if you come to reception and then just ask for me, then I can pop down and...
no, just if you could just leave in an envelope with my name and address on it, and I'll come with my ID to pick it up. That'll be suffice.
Okay, well, I'll see what's normally done, because I don't like leaving things in reception, to be honest.
If you just put it for the attention of Samuel Kahindi and ID required.
Yeah, okay, right. I can certainly have something ready for you by 12.
Wonderful. That's very kind of you. Thank you very much indeed.
Right, okay.
Thank you. Bye.
Okay, bye now. Okay, Mr. Kennedy, Dr.
Now, with due regards to the previous telephone conversation and putting that into our minds, we all have to ask ourselves one simple question. How is it that now Dr. Ali Ajaz is stating that he has other colleagues in the premises, that none of them, absolutely none of them, have a copy of my son's care plan? Nonetheless, let's proceed further. At 11:21 of that same day, some 10 minutes after this particular conversation, Dr. Ali Ajaz does ring back. Again, let's hear what Dr. Ali Ajaz has to say.
Hello?
Oh, hi, Mr. Kennedy, Dr. Ajaz again.
Hello there.
Yeah, so I'm just trying to print out the care plan for you.
Yep.
And what I've noticed is that on the system at the moment, the current one isn't up there from the meeting that happened a few weeks back. So I don't know why that is. But the one that's on there from before, that's a bit old, and it's got kind of old information on which isn't the case at the moment, because I think Olivia's progressed a lot since then. So I don't think it'd be useful to print that out for you, because a lot of the things aren't applicable at the moment, if you see. And I'm trying to find out where the new one is, but it may be that it's just not uploaded yet, but it wasn't me that was doing it, so I can't do anything about it.
Can I stop you there for a second?
Yeah.
Did you not just tell me, and did you not put in print, and have you not repeatedly been telling me you've got a copy of the care plan? Is that not correct?
Well, the care plan's there, yes.
No. Did you not say you do have a copy of the care plan?
I do have a copy of the care plan, but it's not the most current one. That's what I'm trying to say to you.
No. So are you telling me I was coming to a meeting without a current care plan in place? Is that what you were telling me? You're telling me?
Well, the care plan...
And are you telling me I've cancelled appointments just for an hour?
The appointment, excuse me please. The appointment isn't to review the care plan per se. The appointment is to meet with me as the new consultant, that we can work our way forward. And of course we can talk about the current care plan, but it's not to sit down and to go through each and every...
No, beg your pardon. I beg your...
That's not my intention. If you read my emails closely, I said that I want to work closely with you as Oliemi's father, and I want a meeting with you. It doesn't have to be one meeting. We can have more meetings if we want. If there's other things, and I'm sure that'll be good. But the point isn't to sit down and go point by point over the care plan.
No, I'm not asking you to go... No, don't overtalk me. Don't even try to overtalk me. I'm not one of your patients, for starters. Right?
Oh dear.
Don't overtalk me. Good. Now we've got it back to a proper tone level, then we can talk. The fact of the matter is there should be a care plan in place. Full stop.
Now let's listen to the comments of Ms. Maura Carter, who's the secretary for Dr. McAnallen, when challenged about why I was not informed that my son had once again been transferred to another hospital without my knowledge. Furthermore, and in addition to this, I wanted to know why my son, whom they kept as a prisoner for the last 4 years, was now being forced to walk the streets of London.
Oh, good afternoon to you, Mara. It's Samuel, Oliemi's father.
Oh, hello.
Hello,
Hello there. My son got transferred to your John Wilson Centre.
What's it called? Yes.
Wilson House.
Yes.
Wilson
House, yeah.
Right, it was done without my knowledge.
Right. Can I take a message and get someone to call you back?
Yeah, I do need to speak to Dr. McCannon because one, I can tell you here and now, I've just tried to speak to my son about an hour ago, and apparently he's out and about wherever he may well be. Now, the fact of the matter, which is a fact, is you've had him cooped up for the last 4.5 years, and all of a sudden you're allowing him out onto the streets without any directions whatsoever. He's not had any consultation. I've not been to any consultation meeting. He's been transferred without consultation with me. He's out on the streets without consultations with me. So basically, what it looks like to me is being set up to fail.
Oh, right. What I'll do is I'll send an email to Dr. McCannon, and I'll get someone to call you back.
Right. No, it's very serious. And I have to be honest with you, though, his conduct is less than humane. He's actually, I'm going to be honest with you, you can tell him from me, thus far, from the moment I've known him, he's proven himself to be an absolute disgrace. And how he's in charge of people with mental issues, it doesn't even quantify. He's an absolute disgrace. And he's an absolute disgrace. Alongside his Miss Buckshire. They're both an absolute disgrace. And I can tell, you can tell him from me, he's an absolute liar. And from there.
Yeah, I'll send the message, okay?
Now let's listen to my conversation with Miss Catherine Murchie in regards to getting a copy of the care plan which their Dr. Ali Ajaz stated was and is on her computer, but as yet we're now in April 2015, to be more precise, the 30th of April 2015, the last day of the month, and as yet I've still not received any care plans or minutes for any of the other documentation for all the other minutes in the last 5 years.
Hello, Wilson House. Is that Catherine?
Yes, speaking.
Hello, Catherine. It's Samuel, Liam's father.
Oh, hello.
Hello there. I was speaking with Dr. Ali Ajaz last week, and apparently you've got a copy of his care plan.
I don't know whether I've got it yet. I'll have to look.
No, it says on your system, but he couldn't access your password.
Yeah.
So I'm asking for a copy, please.
Right, okay. And how would you be wanting it sent to you?
Perhaps do it by email.
Right. Okay. Is there anything else?
Now, after that request, the event that unfolded thereafter was extremely frightening, beyond belief. It began with the conversation with their doctor, John McCartan, who is the head of the Woodbury ward of Wolfson House. I was forced to bring him after I found that they had once again stopped my son from going to college. Nonetheless, let's hear this conversation.
I want you not to call the nursing station. Is that clear?
when he said, that is there, John McCartan said, that it was a guarantee, I soon found out extremely quickly that he was not joking. But before I disclose the actions that he did carry out, I just want you to listen to the conversation that I had with their Miss Courtney, who is one of the nurses within Wolfson House.
Good morning, Woodbury Road. Courtney speaking.
Good morning, Woodbury Road. Can I speak to Dr. Ali Ajaz, please?
He's not here at the moment.
Okay, can I speak to Catherine Murphy, please?
Sorry, who?
Catherine Murphy.
Oh, she's not here either, I'm afraid, at the minute.
Right, okay.
Can I take a message?
Yes, you can. Say that there's something called the Joint Enterprise Law, and of which everybody's involved. My son's not at college today, and he wasn't at college yesterday. I got informed by the fellow pupils, the teachers, and his college students, and nobody's happy about it. And at the moment, he's in bed.
I'm really sorry, but you'll have to speak to Dr.
Hello?
Hello, sorry. I'm really sorry, you have to speak to Dr. Ali
Can
Ajaz.
I speak to your head of unit, please?
I'm really sorry, but you're not supposed to be calling the ward.
I'm entitled to do that by law. I'm entitled to do that by law. If you have your loved one in trouble, you'll certainly be ringing them. Now I need to speak to your head of unit now.
I'm really sorry. I'll have to take a message and ask them to call you back.
Well, who's the head of unit? What's the name of the head of your unit? What's his name? Who's in charge of your unit? Hello?
I'm really sorry, but...
No, what's the name of the man in charge of the Woodbury ward? What's the name? That's what I've asked.
The manager of the ward, he's not here, I'm afraid.
What's his name?
You have to speak to the doctor.
No,
I'm really
I want
sorry.
his name. Actually, the name of the manager is the same manager I believe that's tracking me with the police. Now I want his name.
He's not here, I'm afraid.
What's his name?
I'm really sorry.
What's his name?
Indeed, I had said I was going to tell you about the actions of the John McCartan in regards to carrying out his threat, but before I disclose that, I actually would like to draw your attention to the comments of the Dr. Ali Ajaz, and then indeed I will disclose that incident. Thank you.
At the same time, I say that you had promised me a copy of the care plan, so I know what I'm looking at, because that's one issue.
Well, I think I'll cut you there, because we had agreed that you'd ask him, and because we talked about having capacity.
No, we haven't agreed.
No, we did. I've spoken to you a couple of times, and this is what we agreed, that because he has capacity, it's about him, all these requests about information about him should go through him, giving him responsibility, and not going over his head. And I have to cut you there, because I had made that point deliberately on a number of, at least 2-3 times.
What in the last 5 years? In the last 5 years?
The times that we've spoken.
In the last 5 years?
Can I just finish? I mean, the times that we've spoken, and you had agreed to that.
No.
You had agreed to that.
I agreed that you'd give me a care plan.
No. You'd agreed that when you'd see your son next, you'd talk to him about it.
No, I did not. I did not agree
for him to come.
I did not agree that. I did not agree that.
Well, I'm sorry. That's my memory and recollection, and that's my documentation of our conversation.
That's not what. That is not what I. And also during the meeting.
If you retract that,
for a minute.
That's what we had agreed.
No, that's not what I did agree. That's not what I did agree.
You're saying something different to me now.
No, I'm not saying anything. Then, in that case, if I'm saying something different, then how comes my paperwork doesn't say anything different? My paperwork are consistent and persistent.
Well, as I once again said, in the last 5 years, the hospitals refused to give me any documents in regards to my son's medical records or financial records or the CPA or his care plans and so forth. They've refused to give me minutes of the meetings I've attended and the minutes that were held in my absence without my knowledge. Nonetheless, what they did do in the end, whilst my son was at college, that's the Wolfham Forest College in the London Borough of well, basically London, so to speak, the London Borough of Woburn Forest. There, John McCartan instructed 4 of their bully boy nurses to go into my son's classroom and forcibly drag him out in front of all of his classmates and teachers. Then, as they were proceeding with taking him out of the classroom and dragging him by force out of the classroom, they let the teacher and the students know that I was next on the agenda. With that in mind, one of the students hastily rang me to warn me that the police are coming to my house alongside these nurses, and I was forced to take every single documentation and every single computer and all of the devices that I've been using for recording, and forcibly forced to give it to all of my various friends up and down the country to prevent it from not being heard, bearing in mind how many prominent people like myself who have such information have ended up disappearing. Nonetheless, I'll leave you with the comments of their Miss Llewellyn Jones.